So in previous class, we talked about generalized fatigue. Okay. Today we are going to talk about chest pain. This is one of the common and important clinical condition in which a person experienced once in a lifetime or multiple times. Nowadays, chest pain are common and secondary due to the cardiac shock or heart attack, patient are dying. Okay. Numerous cases we are seeing nowadays from children to old age people. Everyone is suffered from chest pain, and after later, if they ignore, they will develop heart attack or cardiac shock. So this is very important to us. So the chest pain is what is the reason behind the chest pain? Okay. Basically, in our chest region or else thoracic region, we have very important organs. What are the important organs? We have heart, we have lungs. Okay. Both are very, very important organs which gives us the life. Okay. Due to the lungs, we are taking the oxygen. Without oxygen, there is no life. Okay. But the oxygen is coming from the lungs to the heart first. Okay. Then the heart supply the oxygen to whole part of the body. Okay, with the help of arteries, veins, etc. So basically, if any problem occurs in this pathway, okay, in this pathway, this is a serious trouble. Other than that, we have here number of things in the chest region. We have esophagus, we have throat, we have cervical, we have thoracic vertebrae. Okay. So secondary, there may be chances of other organs other than heart, lungs. Primary, it may be affect to the heart. Secondary, it may be affected to the lungs. Third, it may be affect to the trachea or esophagus. Fourth, it may be effect of cervical issues. Okay. So likewise, there are number of organs or related organs or tissues or nerves or vessels are there in the chest region. So the differentiation is most important. What type of chest pain is that? Okay. So basically, serious chest pain is suddenly it will come. Okay. The pain will attack on the whole body. The patient cannot be controlled. Okay. This is the serious stuff. Or else the chest pain is not relieved by the medication. It is occurring, reoccurring. When you are taking the remedies, it is okay. But after stopping the medications, reoccurrence of chest pain is happening. Or else any particular time or day, the pain is continuously stable. Okay, constantly the pain is there. Okay. So whenever a patient come to your clinic, you have to ask, okay, it is a first time you are experiencing, or it is a recurrent pain, or else you are feeling the pain, mild pain or chest pain continuously for days or hours. Okay. So first, what are the serious causes? We will see here. Then here one box is given in that uh, whoever admitted in the hospital, in that 42 percentage are due to the gastrointestinal diseases. 42 percentage means if a, in the 10 out of 4 person experience chest pain due to the gastrointestinal issues. Okay. And the second, it is due to the heart. It means 10 into in 10 members, we have 3 members who experience heart issues. Okay, the chest pain is due to the heart issues. So other remaining 3 members due to the issue of wall, say chest wall syndrome, pericarditis, okay, pneumonia, pulmonary embolism, okay, the pulmonary vein or artery, in that there is a chance of any kind of embolism, okay, lung cancer, aortic aneurysm, aortic stenosis, or else herpes zoster. So these are the other reasons in the 10 out of 3 members or 100 in the 100% we have that 20 to 30 members will experience the chest pain due to the other reasons, primarily due to the gastrointestinal disease, secondary due to the cardiovascular disease, third other reasons are here. Okay, so the serious cause, because we have to differentiate between gastrointestinal chest pain and cardiovascular chest pain. So because if this is cardiovascular pain, it is emergency. You need emergency treatment. So what type of problems may happen for the cardiovascular diseases? So here only we are talking about chest pain, not the complete disease. Complete disease we will talk in cardiovascular diseases. Okay. Here myocardial ischemia. Okay. Here heart is covered by the one muscle, myocardium. Okay, the myocardium is responsible for the contraction and relaxation of the heart. So the muscle is damaged due to the not supplying of blood vessels, not supplying of the blood to the muscles. Okay, so it will cause chest pain, angina pectoris, we will call angina pectoris. So in this condition, what the patient is given sublingual remedy or medicine. So the chest pain will relieve for some time. Okay, so that is nitroglycerin. Yes. And the second is acute myocardial infarction. So it is the beginning of the damage of the myocardial wall. Okay, in this we have hard sounds. We have 4 hard sound: S1, S2, S3, and S4. S3 and S4 cannot be heard with our stethoscope. Understood? So here you can able to hear the hard sounds. Hard sound is due to the opening and closing of the valves. Okay, already I teach in the cardiovascular anatomy and physiology. We have aortic valve, we have pulmonary valve, okay, we have tricuspid valve, we have bicuspid valve. So those valves opens and closes, so you may get the sound from the heart. So basically tricuspid and bicuspid valve closure and open, you will get the sounds, that is S1 and S2. But in S3 is for S4 for the closure and opening of aortic and pulmonary valve. So you cannot hear with your stethoscope. The doctor is keeping the stethoscope for hearing, okay, for hearing hard sounds. Basically, this is the stethoscope, okay. You have to use this, okay, to hear the hard sounds and just sounds also, inhaling and exhaling. Basically, to examine the lungs and hearts, we need stethoscope. Okay, we also learn how to use the stethoscope. So basically, in this an acute myocardial infarction, you can hear the S4 and S5 sounds. Okay, so here one diagram is given, very important to us. You can understood this and you can able to get the closure to the chest wall, chest pain diagnosis. Here localized, sharp and dull or dull pain. reproduce by pressure over the painful area. So this type of sign and symptoms, it leads to due to the chest wall pain, the muscles of the chest wall or ribs, the involvement of this. Okay. And sharp pain, your chest is sharp pain, but it is coming from the any other part of the body, or if you are moving your neck, the pain will increase in the chest region. So it will give us the idea that the patient have cervical or thoracic spine disease. Okay. And we have dysphagia, difficulty in swallowing, and we have indigestion of food, or when you are sleeping, the you have bloating in the stomach, and you experience the gastric juice or burning sensation throughout the throat. So it gives the idea that due to the esophageal or gastric issues, this is gastrointestinal issue. Okay. If you are eating the food, fatty food, after eating fatty food, you are getting the pain, or mostly right upper quadrant. It means that is the problem in the biliary, gallbladder issues or liver issues. Okay. If the pain is there, and it is due to the most of the emotional, due to the emotions, you are getting the pain and the pain is increasing, and if you are doing ECG, because every chest pain need ECG, because to differentiate from the other uh, diagnosis. Okay. So what doctors do? Doctors will put the sublingual remedy if any issues of the heart. Okay. What is that is TNG, trinitroglycerin. Okay, which will widen the arteries and the blood flow to the heart increases. Okay. So it will protect the heart from damaging. Okay. So here we will confirm that it is myocardial ischemia. In the ECG, we will see ST segment. Okay. In the ECG, what we will see? We will see ST segment shift. Okay. So that we can understood that that is myocardial ischemia. So we have to take cardiologist opinion also, because the diagnosis of the heart issues will take further investigations. Okay, we need to take the help of cardiologist. Okay, so how can we differentiate the chest pain in a different way? Here we understood. Okay, so we have severe issues. We talked about two things: myocardial ischemia, acute myocardial infarction, and other is pulmonary embolism. It is also very dangerous. Okay, the clot in the pulmonary artery, the blood supply to the lungs. Okay, the heart will supply the pulmonary, the lungs to purify the blood. Okay, and the thoracic aortic aneurysm. It is also the artery, large artery, which is supplying the blood to the lungs. There is any rupture in this artery, it leads to dangerous issues. Aortic dissection. It is also aortic aorta. So in a large artery, there is a problem in the large artery. It is very severe, and you have very sharp chest pain, and it will radiates to back. When you change the position also, you will get the pain. Okay, this is very dangerous and very serious issue. And mediastinal emphysema. Okay, this is the mostly lung issues. Okay, damaging of the or blockage of the lungs, lungs alveoli. Okay, acute pericarditis. It is also very issue. Pleurisy, which is the problem of the lungs. So here it is maybe due to the problem of the heart, problem of the lungs, or in between circulation of the heart or lungs. Okay, so this is very serious issues. And less serious issues, we have costochondral pain. Means we have the muscles in the between the ribs, which help for inspiration and expiration, okay, or esophageal pain, or emotional disorders also, which leads to chest pain, okay. And we have other causes also, cervical issues or cervical osteoarthritis, or we have abdominal issues like peptic ulcer, hernia, pancreatitis, biliary colic, okay, tracheobronchitis, pneumonia, or in the females, breast issues, intercostal neuritis. Okay, so these are the other causes which leads to chest pain. Okay, so you have to remember all those things while examine the patient. But in the 100%, we have 30% cardiac issues, 40% gastrointestinal issues. Other than that, are 30% are other issues. Okay, so we have to differentiate all those things. How to approach? This is very important. Basically, whenever a chest patient will go into the hospital or any clinic, okay, we'll check the vitals, BP, uh, pulse rate, and when the chest pain occurs, if it is cardiac, one main sign that is SOB, shortness of breath, one of the main symptom you can get the trigger that this is belongs to cardiac issue, mostly cardiac or pulmonary issue. Okay, so you have to ask the patient while talking, he will he will do that. Okay, and he have severe sweating, and he will tell that my left hand is getting the pain, and he unable to lift the hand. Okay, so this is very serious issue. You have to take to nearby hospital. Okay. And the second thing is that they will do what they do. They will put a sublingual remedy for that, for widening of artery and veins. And third thing is that you have to, the doctor, in the hospital, the emergency doctor will do the ECG, advice for ECG. If the ECG is abnormal, already we talked about the ST segment is in the ST elevation, PR segment elevation, okay, and ECG, and we have cardiac markers. They will do cardiac markers testing. One is ECG, and second is cardiac markers. In EVIL, we check the tropi. Tropi is a protein which will present in the muscle. Okay, if the muscle is losing its life, so it will get into the bloodstream. So we'll check the tropoid. If the heart muscles are damaging, we will check the tropoid to check that the damages of heart muscle is happening or not. If it is more high, it means the heart muscle is damaging. It will not getting proper blood flow. Okay, so it will it will advise by the doctor. Then after it will they will do CT angiography. Okay, they will check how many blood vessels are blocked, like other investigations they will do. But if after diagnosis, what we can do in an electrohomeopathy, it is one of the important thing. And second thing is that in the electrohomeopathy, what you can do till you reach in emergency care. So you have to advise, or if the patient comes to your clinic till he reach emergency care, it will take 10 minutes, 15 minutes, half an hour. In the villages, it will take longer than 1 hour, 2 hour. So I experienced number of patients from the village. They want to go to the upper centers, higher centers. They doesn't have basic facility. They doesn't have primary healthcare center. So they took the ambulance, and they cannot reach to the hospital. The patient died. Number of incidents happen. So at that time, if a patient comes to your clinic or he is a relative of your your okay, if he is his own family member, so what we can do? So we have electrohomeopathy remedies. Just uh, it is not the thing that is help the patient, but it is the thing which can survive the patient till emergency care. Okay, so we have to basically very carefully we have to treat these patients. Okay, so basically and diagnosis is very important, the cardiac patients. So basically in electrohomeopathy you have one remedy, that is A3, which will work on the heart, arteries, veins, because we cannot differentiate whether the right side of the heart is affected, left side of the heart is affected. Okay, so we have to wait till the diagnosis happens. After diagnosis, we can advise the patient the main remedy to cure the disease. So here, till that, we can use A3, we can give in D6, okay, direct on the tongue, and you have to apply BE on the heart in D4. Or D4 or D6. This is the basic remedies we can advise to the patient if it is belongs to cardiac issue till he reach the emergency care. And you have to other than electrohomeopathy, we have different therapies also in the acupuncture. We have emergency points. Basically, we have to treat that emergency condition till the patient reach to the hospital. Okay, so you can advise this remedy A3 in D6 or PE to apply the the heart region. Okay, to improve the circulation. So both will help the patient. Okay, it is less if the all the walls are blocked or the pulmonary valve is blocked, so the patient is not receiving minimum amount of blood supply, the patient will not survive. If there is problem more than 95, 99%, the patient will not survive. The problem less than 80%, the patient will survive. 80 to 90% or 50 to 50%. Okay. So I think you understood about chest pain, how many different types of pain are there, how should we differentiate, and what type of questions we have to ask the patient. Okay. So this is all about chest pain. Okay. If anyone have any doubts, kindly ask.